Okay, guys, so we're gonna do chapter seven, lifespan development. It really should be pretty quick. Um, so we're gonna try to cruise on through this. Let's see. So introduction, human development throughout lives. EMT must be aware of the physical changes a person undergoes through the various stages of life. So from neonate or newborn all the way through our elderly, the things that the changes that each person goes through and how we need to identify it. And it might affect the way we approach or we assess our patients. So, right off the bat, we're going to deal with neonates. This is birth to 1 month old, infants, 1 month to 1 year, and they develop at a startling rate there in the beginning. Let's see. The weight, we're gonna neonates weigh 6 to 8 pounds, 3 to 3.5 kilograms at birth. Um, the head accounts for 25% of the body weight, so that's important to remember. The head is a lot heavier than the rest. It's larger in proportion when they're younger. Um, and that's why a lot of injuries to neonates, infants, and toddlers are head traumas because when they fall and their head's the heaviest, so they're kind of top heavy there. Growth of about 1 ounce per day, and then weight triples by the end of the first year. So, our neonate and infant's cardiovascular system at birth, the neonate makes the transition from fetal to independent circulation. So, we go from mom producing and feeding the blood and nutrition to now the independence of that little bee heart trying to start up and uh, support the body. The pulmonary system, infants younger than 6 months are prone to nasal congestion. Infants have a larger tongue and shorter, narrower airways, so airway obstruction is more common than in most or in older children or adults. So when we're using that BVM, the lungs are not as developed yet. So anytime we're giving those rescue breaths, we need to be very careful so we don't cause that barotrauma, trauma to the lungs. I'm gonna be an old guy here and put my glasses on so I can actually see what I'm reading. Oh, much better. Okay. The nervous system evolution continues after birth, so they are still forming. Nothing is actually fully formed with these neonates and infants, so everything is still growing and trying to form. Uh, so then we go into the motor reflex. Neonates open their arms wide, they spread fingers and seem to grab at things. You do need to kind of remember what these reflex are. The palmar grasp occurs when an object's placed into the neonate's palm, and they'll close around it. Rooting reflex, neonates instinctively turn their head when someone touches its cheek. And then sucking reflex occurs when the neonate's lips are stroked. The fontanelles is space between the bones that eventually fuses to form the skull. Posterior fontanelles fuse by 3 months, and the anterior fontanelles fuse between the age of 9 to 18 months. I think there's a picture coming up, but this is the bones of the skull. Yep. So all of these bones will slowly fuse together. This right here, this anterior fontanelle. This is something we can use to identify swelling or dehydration. So on an infant or neonate, if this area of the head is kind of sunken in, and you can almost see a little divot, that means that there's dehydration. And then if for some reason if it's popped up, and you can feel it or you can see it, that means we've got pressure in the brain or we've got swelling or something going on there. The nervous system. So 2 months of age, tracking objects with their eyes and recognizing familiar faces. So this is at 2 months, they should recognize at least mom and dad. At 6 months of age, they're sitting upright and they're kind of babbling. And then at 12 months age, they're walking with minimal assistance. Their immune system, it maintains some of the mother's immunities for a while. Infants can also receive antibodies via breastfeeding. So breastfeeding is very beneficial if you're able to do that. Um, the changes that we're going to see beginning at birth and evolve as an infant interacts with the environment. So they're born, and as we get older, so at 2 months, we recognize familiar faces. We track things with our eyes. At 3 months, we bring objects to our mouth, smile, and frown. At 4 months, reaches arms out to people and drools. At 5 months, sleeps throughout the night, uh, distinguishes family members from strangers. At 6 months, begins teething, sitting upright, speaks one-syllable words. 7 months, afraid of strangers and displays mood swings. At 8 months, we respond to no, can sit alone, plays peekaboo. At 9 months, pulls self up and stands, explores objects by placing them in his or her mouth. At 10 months, respond to his or her name, crawls effectively. At 11 months, we begin to walk without assistance, becoming frustrated by restrictions. And then at 12 months, knows his or her name and walks. So there are going to be quiz questions and test questions over some of these. So either take a picture of this or know where this chart is in your book. It's table 7-2, because there will be questions on that. Crying is a main method of communication or communicating distress. They can't speak to us. So when they're crying, we need to pay attention. If they're not crying, we need to pay attention also. Infants develop relationships with their parents and caregivers at different rates. Bonding is based on secure attachment. Anxious, avoidant attachment is found in infants who are repeatedly rejected. Separation anxiety is common in older infants. And then trust and mistrust involves an infant needs being met. The cardiovascular system of a toddler 1 to 3 or a preschooler's 4 to 6 is not dramatically different from an adult. Preschoolers 3 to 6, our pulse is going to be 80 to 140. Respiratory rates 20 to 25. Our systolic blood pressure is anywhere from 80 to 100. Preschoolers do not have well-developed lung musculature there. Weight gain should level off. Passive immunity is lost. That neuromuscular growth also makes considerable progress at this age, and average age of completion of toilet training is about 28 months. So we're still developing. Our muscles are starting to actually form, and you're going to start seeing these growth spurts at this age. We should be potty trained. They're not going to be gaining or losing weight a lot like your neonates or infants are. Learn to speak and express themselves, master basic language, interact and play games with other children, begin to understand cause and effect, and then learn to recognize gender differences by observing role models. And then we move on to what we call school age children. This is 6 to 12. Physical traits and functions continue to mature at a rapid rate. Growth of 4 pounds and 2.5 inches a year. There's that like major growth spurt. Permanent teeth start coming in, so we're losing baby teeth. Brain activity increases in both hemispheres. Pre-conversational reasoning. So children act to avoid punishment and get what they want. So they're starting to learn how to play the game. Uh, Conventional reasoning. Children look for approval from peers and society. Post-conversational reasoning. Children make decisions guided by their science. And then self-contempt and self-esteem develop. So at this age, children kind of become who they're going to be based off how they're treated and how the world interacts with them. Um, this is where, like, that self-esteem development, they start becoming who they're going to be. At 12 to 18, teenagers, vital signs level off, pulse of 60 to 100, respiratory 12 to 20, systolic blood pressure is going to be 90 to 110. 2 to 3 year growth spurt. Girls finish by 16, boys by 18. Reproductive system matures, secondary sexual development takes place, voice starts to change, menstruation begins, and acne can occur. Adolescents and their families often deal with conflict. Privacy becomes an issue, self-confidence increases, and adolescents may struggle to create their own identity. Antisocial behavior and peer pressure peak at the age 14 to 16. Smoking, illicit drug use, unprotected sex, eating disorders, code of ethic develops, high risk of suicide and depression at this age. Early adults, 19 to 40 years, vital signs do not vary greatly. So our pulse is 60 to 100, respiratory is 12 to 20, and systolic blood pressure is going to be 90 to 120. From the age 19 to 25, the body should be functioning at its optimal level. Lifelong habits are solidified. Life centers on work, family, and stress. Settling down, marriage, and family, one of the more stable periods of life. 41 to 60, this is middle adults or middle-aged adults. Vital signs remain the same. Pulse 60 to 100, respiratory 12 to 20, and our blood pressure 90 to 140 systolic. Variables to vision and hearing loss, or vulnerable to vision and hearing loss. Cancer incidence increase. Menopause occurs in late 40s or early 50s. Diabetes, hypertension, and weight problems are common. Exercise and healthy diet can diminish the effect of aging. Focus on achieving life goals. Regis lifestyle as children leave home. Generally have a physical, emotional, or spiritual reserve to handle life's issues. Finances become a concern. Maybe caring for both children leaving for college and aging parents at this point. Then we go to older adults, 61 years and older. Life expectancy is constantly changing. Now, approximately 78 years is life expectancy. The cardiovascular system declines with age, largely due to atherosclerosis or hardening of the arteries. The heart rate and cardiac output decreases. Vascular system becomes stiff. Ability to produce replacement blood cells declines, as does blood volume. The respiratory system, size of the airway increases, surface area of the alveoli decreases. Naturally, elasticity of the lung decreases, breathing becomes more labor intensive. So if you think about it, and we've talked about it a little bit, I think, those alveoli and the lungs themselves. So they've spent 60 some years or 70 or 80 years expanding and contracting, every time we take that breath. At some point, that elasticity that allows that stretch is going to start to wear out. If you blow a balloon up every single day, 10 to 20 or 12 to 20 times a minute, at some point that balloon's going to give out, right? So that's what our alveoli and our lungs are starting to do, and even our heart muscle. At some point, we start wearing that out. That stretch is going away. And that's what's happening here in these older adults. Respiratory system, so vital capacity decreases, chest becomes more rigid and fragile, cough and gag reflexes diminish, greater risk of aspiration and airway obstruction, more susceptible to lung infection. The endocrine system, insulin production drops off, metabolism decreases, and our reproductive system changes to some extent. The digestive system, taste sensation decreases, salivation secretion decreases. The ability of an intestinal tines, to contract and move food diminishes. Gallstones become increasingly common. Anal sphincter changes can produce fecal incontinence. The renal system, so filtration function declines, the kidney mass decreases by 20%, diminished blood flow to the kidneys, and then decreased ability to clear waste from the body and the ability to conserve fluids when needed. Our nervous system, the motor and sensation uh, neuron network becomes slower. Neurons are lost, but there is no loss of knowledge or skills, and then sleeping patterns will change. Age-related shrinking creates a void between the brain and the outermost layer of the meninges. So our brain actually does shrink. So we are at a higher risk of head trauma. If we fall, we hit our head, we have more room for that brain to rattle. So it becomes increasingly troublesome. Peripheral nerve sensation is diminished, increased reaction time causes longer delay between stimulation and motion, slowdown in reflexes, and decreased kinesthetic sense may contribute to falls and trauma. The sensory changes, so most older adults can see and hear well, may need glasses or hearing aids. Visual distortions are common. Hearing loss is 4 times more common than visual loss. Psychosocial changes until about 5 years before death, most people retain high brain function. Statistics indicate that 95% of the elderly live at home. Financially limit may restrict access to health care and medication. And then our psychosocial changes also, more than 50% of all single women in the US who are 60 years of age or older are living at or below poverty line. Elderlies need to face their own mortality, and the isolation and depression can be challenging. So that wasn't too bad. When providing bag mask ventilation to an infant, what is the most important to remember? Um, well, there's a couple right answers there, but I think it's going to be B. There we go. You see an infant capable of reaching out to people and drooling, she is most likely. C. Okay, 4 months. That's why I said take a picture of that or find it in your book and learn it. An infant who is repeatedly rejected experiences what type of attachment? I think it's A. Nope, I was wrong. It is anxious avoidance attachment. Okay. Can't get them all right. Why do cold develop so easily in toddlers and preschoolers? D, all of the above. So they experience the loss of that passive immunity that they got from mom. They do not have well-developed lung musculature. I can't say that. They're spending a lot of time around playmates and classmates. So when we get around a lot of people, yeah. The pulse rate for a toddler is A, it's 90 to 150. Or sorry, B, it's 90 to 150. A school-age child looking for approval from his peers and society is demonstrating what kind of reasoning? B. Self-consent concept is A. Self-concept is how we perceive ourselves. Why should you be concerned about a 16-year-old patient who seems depressed? I'm going to say C. There's a higher chance of suicide on those teen ages. Why do finances become an issue during middle age adulthood? I'm gonna go with A. A lot of times we're dealing with children moving into college and moving out, and our parents are declining, so we're trying to take care of them. So the answer was A. Why is breathing more labor intensive for the elderly? Oh, there's a couple on here that could be right, but I'm gonna have to go with D because all of those are actually correct. All right, guys, that was chapter 7. I will see you on chapter 8.